Hello, and welcome to today's course on procedures for checking and recording vital signs. My name is Elizabeth, and I will be guiding you through today's content. Today's objectives of the course will be to discuss what vital signs are, why vital signs are important, when vital signs are usually taken, how to take vital signs, how to appropriately document these vital signs, and consequences of inappropriate documentation. So, what exactly are vital signs? There are 5 vital signs that are considered the cardinal vital signs. These include pulse, respiration rate, blood pressure, oxygen saturation, and pain, which is considered the 5th vital sign. Let's talk about pulse first. This measures the heart rate and rhythm. Overall, it indicates the heart's health and circulatory system efficiency. An irregular or abnormal pulse could indicate cardiac issues or other systemic health problems. What are respirations? This is observing the rate, depth, and pattern of a patient's breathing. Respiration metrics can reveal issues related to lung function as well as oxygenation. They can also signal distress and or anxiety. Temperature. This is a crucial indicator of metabolic and thermoregulatory function. An abnormal temperature can indicate infections, inflammations, hormonal imbalances, and even reactions to medications. What is blood pressure? This measures the force of blood against artery walls and can be an indication of cardiovascular health, a risk of stroke, and other conditions like hypertension or hypotension. Hypertension is high blood pressure, and hypotension is low blood pressure. Systolic pressure is the higher number or the number on top, and this is the pressure in the arteries when the heart contracts. Diastolic pressure, or the lower number, the number on the bottom, is the pressure when the heart is at rest between beats. Oxygen saturation is simply the measure of percentage of oxygen that is in the blood. Pain assessment is considered the only subjective vital sign. There are various ways to assess pain, one of which is to use a numeric scale from 0 to 10. Let's talk now about why vital signs are so important. Vital signs are imperative in assessing general physical health. They are fundamental in routine health assessments. Vital signs do provide a baseline to compare current measures with past records in order to detect deviations from a patient's normal range. Regular monitoring of vital signs can preemptively alert healthcare providers to health issues even before symptoms become apparent. This allows for early intervention. It is also helpful when assessing if medications are having an appropriate effect on patients. Vital signs are also important in identifying signs of potential diseases. Abnormal vital signs can frequently be the first indicators of underlying health issues. For example, a spike in temperature might indicate infection, while a drop in temperature could indicate hypothermia. Blood pressure changes or changes in pulse rate can indicate cardiovascular issues, stress responses, and other systemic conditions. Observing patient respirations can aid in detecting any respiratory disease, anxiety disorders, and also metabolic imbalances. Vital signs are also extremely important in monitoring during a recovery. Vital signs are critical in tracking a patient's recovery and response to treatment during treatments and also post-surgery. Consistent or improving readings may indicate effective treatment and recovery. Fluctuations and or deteriorations during treatment or post-surgery might necessitate a change in medical approach or further investigation. When vital signs are taken, there are various scenarios in which vital signs may be assessed. The following are not completely inclusive. When a patient is admitted to a healthcare facility, when a patient is inpatient in a hospital, vital signs will be taken per the hospital policy and or per the medical doctor's order. These are usually monitored every hour to every 4 hours depending on the health status of the patient. Vital signs will be taken during a clinic visit. They will also be taken before, during, and after a surgical procedure, as well as before, during, and after an invasive diagnostic procedure. Vital signs would probably be taken when a patient experiences general physical changes, such as loss of consciousness, an increase of pain, and even when they say, I feel different or I feel funny. Vital signs are often taken before and after nursing interventions, such as toileting a patient, walking a patient, and doing PT exercises. Who do we expect to take vital signs? This could be EMTs, paramedics, medical assistants, nurses, doctors, and CNAs. There are various other individuals who can take vital signs, such as people who complete CPR training, dental hygienists who assist during dental procedures, and so many others. Let's now go over appropriate procedures for checking vital signs. When taking a pulse, the provider will count the heartbeats for 60 seconds or will count the heartbeats for 50 seconds, then multiply by 4. Healthcare providers also assessing the state of the pulse, whether it's strong and regular, weak and irregular, or maybe pulse differences in one limb versus the other. The pulse is taken by the provider either at the carotid, brachial, or radial artery. Pulse can also be taken by simply placing a stethoscope on the chest over the heart. To assess for respirations, the healthcare provider will count the number of breaths taken by the patient for 60 seconds or for 15 seconds and multiply by 4. The provider will simply observe the patient breathing. During their assessment, they are also noting if the patient appears to be struggling. Is one side of the chest rising while the other is not? Is there an audible wheeze without a stethoscope? And is there a cough, and whether it is productive or dry? Blood pressure is taken using a blood pressure cuff and a sphygmomanometer or an automated blood pressure monitor. It's taken in the right or left arm, typically at the bicep, but it can be done on the forearm. Some things to note would be that blood pressure cuffs should not be placed on the same side as a dialysis shunt or fistula, and it's also not taken on the same side as a mastectomy. Oxygen saturation is simply measured with a pulse oximeter that's typically placed on a fingertip. Oxygen saturation can also be taken with a soft adhesive probe and placed on an earlobe. To assess pain, the patient will simply be asked if they are in pain and to rate their pain on a scale. The scale may be numeric. It may also be just a facial scale, with images of faces appearing to be in no pain to excruciating pain. Now let's go step by step in how to take vital signs. To measure a pulse, the first step is to wash hands thoroughly or to use hand sanitizer. We are going to find the patient's pulse using the radial artery that's located on the inside of the wrist near the thumb. Using your first two fingertips, you will gently feel for the pulse. We are never ever going to take a pulse with our thumb. We're going to locate a wall clock or use a watch with the seconds hand visible. We're going to time our count with the seconds hand or the seconds on the watch, and then count the beats for a full minute in order to ensure for accuracy. Again, some providers will count for only 30 seconds and multiply by 2, or count for 15 seconds and multiply by 4. We are going to focus on the pulse beats rather than the seconds hand on the clock or our watch. This is so that we can assess if the pulse is strong or weak, thready, regular, or irregular. The first step in assessing our respiration rate is going to be to wash our hands thoroughly or use hand sanitizer. We're going to observe the patient breathing and count the number of breaths they take for 60 seconds. Please remember a full breath includes both an inhale as well as an exhale. And also remember that some providers count for 30 seconds and multiply by 2, or they will count for 15 seconds and multiply by 4. We're going to observe not only the count of breaths, but also what those breaths look like. Is there an uneven chest rise and fall? Are they wheezing? Are they showing any signs of distress? Measuring temperature with a digital thermometer. Once again, we're going to wash our hands thoroughly or use hand sanitizer first. We will make sure that we have a clean thermometer that has a disposable probe cover. Activate the thermometer and place it under the patient's tongue near the back of their mouth, and then ask them to close their mouth. We need to make sure that the patient does not try to talk with the probe in their mouths or bite the probe. We also need to make sure the patient has not had anything to eat or drink in the last 15 minutes. Either of these will make sure that the accuracy can be called into question. Once the thermometer beeps, we're going to remove the thermometer and record the temperature. Dispose of the probe cover in the trash. And once completed, always clean and sterilize the thermometer after every use. Measuring blood pressure. First and foremost, again, we're going to make sure our hands are washed or use hand sanitizer. We're going to disinfect the stethoscope head. And we're going to confirm the blood pressure monitor is functioning properly. Next step is to locate the brachial pulse on the patient's arm. Many of the blood pressure cuffs do have arrows pointing, showing you exactly how to put it on the patient's arm. We're going to wrap the cuff around the arm above the brachial pulse and then inflate the cuff to the specified level. Typically, inflating the cuff will be to 170 millimeters of mercury, but you may need to go higher for a patient with known hypertension. We're going to release the air slowly while listening for the first and last thumps in the artery. Afterwards, we're going to document the readings and any unusual findings. When assessing a patient's pain, not only are we going to ask them if they are in pain and to rate the pain, but we may ask them additional questions such as onset, when did the pain begin? Provocation and palliation, what makes the pain worse or better? And we may ask them about the quality. Describe the pain. Is it sharp, dull, stabbing, burning, etc.? We're going to ask about the region and radiation. Where does it hurt? And does the pain spread anywhere else? We will use that rating scale for the severity of the pain. And we're also going to ask how long the pain has been present. There are normal ranges for each one of our vital signs. For a pulse, the normal range would be 60 to 100 beats per minute. Respirations are considered normal between 12 and 20. Normal body temperature is around 98.6, but you can always ask the patient where their normal is. Some people run a little cooler, some people run a little hotter. A normal blood pressure is around 120 over 80, and normal oxygen saturation is 95 to 100%. Once you have taken your vital signs, you need to appropriately document them. Accurate vital sign documentation is extremely important. This is because vital signs can be used to assess the patient's condition and overall health status. Vital signs also inform the caregiver what type of care intervention may be most appropriate. There are numerous ways to record vital signs. These may be entered into an electronic medical record, or EMR. They may also be written in a paper chart. There are monitors in hospitals and clinics that also automatically upload vital signs into an electronic medical record. And we can also use these to track and trend. When recording data, we always want to make sure it is as accurate as possible. If writing vital signs, then you need to write legibly. If typing, then type accurately and in the correct location of the EMR. Familiarize yourself with how your specific clinic or hospital wants this documentation in the EMR. We want to be concise with objective data. We're going to record the complete data, including any abnormalities seen. We will always remain free from bias when documenting. Vital signs should always be recorded between patients to ensure the correct vital signs go with the correct patient's chart. We're always going to sign our notes with our name, and we're going to keep healthcare documents in order. Always remember to maintain HIPAA compliance at all times when concerning the patient's medical record. And always, always, always inform the nurse, the charge nurse, and or the doctor if there's any immediate concern when taking your vital signs. Because accurate medical documentation is so important, there are consequences to poor medical record keeping. Incorrect vital sign charting can lead to medical errors, such as a prescription of a medication to a patient who doesn't need it, over-medicating or under-medicating a patient, and missing indications of a serious health condition like a heart attack, an asthma attack, or a stroke. Medical errors can lead to patient injury, patient death, job loss, and even legal penalties for healthcare staff. Always be sure to document accurately. This is the end of our presentation today on assessing and accurately recording vital signs. Thank you for your participation.